Okay. Hi everyone. I have a question for you. How many hours of arts engagement is associated with good mental well-being? Almost, very good. I will provide you with that answer by the end of today's session, but it's good to know that that took me 4 years to find out the answer. So my name is Christina Davies. I'm a research fellow at the School of Population Health, UWA. My background is health promotion evaluation, mental health, in relation to arts and health, so my focus is mental health. But importantly, I'm also a practicing artist. So I'm going to say a lot of statsy stuff today, but I'm also a painter. So today, I'm going to be talking about my research to quantify the arts-mental health relationship. I'll be showing you some studies, and also how I've used this for advocacy and evaluation. So there's 3 studies. One is to define arts engagement, and the reason why this is important is because we're using a lot of different definitions. And for studies to be well developed, we need to have a good definition, but also for them to be comparable, there needs to be a good definition, and we need to be using the same definition. The second study then looked at, well, what are the outcomes? What are the outcomes when we engage in the arts? And I've got a fabulous list for you. So everyone needs some handouts. So you should have one of these, which is my slides and information. But you should also have one of these. No? So they're coming around.
Sorry.
That's all right. So while they're going around, and then what happens is both of them come together and you'll have the quantification of arts and mental health. Okay, so now in terms of advocacy, I just want to be clear that I'm being very broad in my definition here. I'm talking about knowledge, but I'm also talking about raising support for the arts. So the arts in general, arts programs, policy, so especially the National Arts and Health Framework, funding and participation. We want the general population to be engaging in the arts. And when it comes to advocacy, what are we talking about? So we're targeting it at the general population. We're targeting it at funders, philanthropists, government. Also, the media. Make sure when you actually do something that you tell the media about it. They love good news stories, so make sure you're telling people about it. And then also experts in the field. We need to be sharing information. Now, how? So I've done this in a number of ways. So we had this question this morning, which was, well, how do we advocate? Well, Twitter, Facebook, social media is fantastic for this. Also, make sure you do a media release. When you've done a great program, when you've got a great evaluation results, do a media release. The newspapers, radio, magazine, e-articles, all of them fabulous for the arts. Also make sure you correspond with your minister. It doesn't need to be a letter. You can send him or her an email. I send them emails all the time, and they respond. And also blogs, webinars, presentations, publications. So when you do an evaluation, make sure you're actually writing it up so that you can send it to people. Okay, now, so that was advocacy, evaluation. So this is where we're assessing something. So we might use a survey to do it. And it can relate to policy, it can relate to practice, it can relate to programs and projects. And it can occur before, so this is a formative evaluation, during, or at the completion of a project. So what we're interested in here are whether or not objectives have been achieved. So they may be your program objectives, or if you've been funded, they may actually be something that your funder is saying you had to have achieved. So you might do an evaluation to find out about that. And then also effectiveness, process, impact, outcomes, all of those are important. Something though that I will say is, when you hire your evaluator, make sure they are doing an evaluation, not research. Because there is a very big distinction between research and evaluation. And so very quickly to summarise it, when you do research, the research is the most important thing. So someone will come in, they'll sign their consent forms, they'll look at their information sheets, they'll fill out a 100-page survey, and that's okay because they were there to do research. But when you do evaluation, the thing that's important is the program. So you don't want to do anything when it comes to an evaluation that affects your program. So an evaluation is usually short and to the point, and you're asking what you need to know. Okay, so important to remember. Okay, so why research arts engagement and mental wellbeing? Why quantify this relationship? Well, I think for me, it's about funding and community support. A lot of the time we're talking about value at the moment. So when usually we talk about value, we're talking about participant numbers, how many people turn up to our events, or we talk about the economic impact. But how many people here run arts projects or programs or workshops or work for arts organisations? Yeah. When you run them, you know that people are getting more out of it. But we rarely talk about that. So my way of talking about the extra value that we're getting is in terms of health and mental health. And I think that if we can support this by research, one day I'm hoping that we will have a health message for the arts. And why would we want a health message? Because this tells people why they should engage in the arts, but also how much art they should be doing. So what I've got here is, these are all health messages for sport. Everyone knows the Find 30 message, or the Life Be In It, sport for all, be active. Well, sport have been ahead of the game. They have over 80 years worth of scientific research linking sport and health. 80 years. Now, what this means is that sport is in the hearts and minds of people, not just because sport's fun and it's great to do, but sport's good for your health. You should be doing it. And not only that it means that sports actually have sports organisations promoting them, but they also have health organisations promoting them. And health, they are a great advocacy group to have on board. We need them on board. We want them on board. Okay, so study one. I'm going to go through this one very quickly. So we had to define arts engagement. Why? Well, because we need to, like I said, have a definition. We need to be talking the same language. We need to be able to develop good studies, and we need to be able to compare our studies. So what we did was, I didn't make up this definition. I actually asked 280 national and international experts in the field of arts and arts health what they thought art was. So we asked them to list the arts activities, and then we asked them to rate how much art you got when you engaged in those activities. And what they told us was that they thought there were 5 art forms, so performing arts, visual arts, design and craft, literature, online, digital and electronic arts, community and cultural festivals, fairs and events. There were 91 different activities that they talked about, 91. And with these 91, that there were different levels of engagement. Overall, though, the active arts engagement was actually rated higher than the more receptive activities. So making was rated higher, say, than attending, which kind of makes sense. So why is this important? Well, it means now that we have a definition for the arts. And it means that if I want to do a survey, I can actually ask people about the arts. Because the thing is that you can't just say to people, do you engage in the arts? Because they don't know what art is. So instead, you've got to flip that around and actually say to them things like, attendance is, blah, blah, blah. In the last 12 months, have you gone to? And that's why we need the activities. So what we have now is a list of art forms, a list of activities, and also a measure of exposure. And this paper is currently being used by Healthway in their survey of recreation and health to actually guide their arts questions. Okay, second study. So then we wanted to find out, well, what are the health outcomes? So now this paper is actually free. So if you're interested in this, The Art of Being Healthy is actually published in BMJ Open. And BMJ Open, that's actually British Medical Journal group. So that's actually in a health journal. So they've got to take it seriously when it comes to that. We were talking this morning about how do we get health on board. Well, this is one of the ways. We need to be publishing in their journals. So if you are applying for health funding and you're actually quoting health journals, that's a positive. So we wanted to explore the positive, the negative, and also the unintended outcomes relating to the arts. We did interviews with members of the general population. And I want to be clear here that what I'm talking about is the arts that people do as part of their everyday life for enjoyment, entertainment, or as a hobby, even if they don't realise that that's what they're doing. They don't realise that that's art. So I'm talking about the music that they listen to. You can't really see that, can you? The music that they listen to, the books that they read. I'm talking about the plays that they go to, the concerts, the art galleries, the movies. Painting, singing, dancing, colouring books at the moment, number 1 and 2 bestseller on Amazon. They are engaging in the arts, they just don't realise it. Oh, and also what was important here was that people seem to have a preference for a type of art, but they engaged in a variety of art forms. So say for me, I might be a painter, so my preference is the visual arts, but I also go to music concerts, I also read novels, so I'm actually engaging across the board. And that's what it is for most people as well. What we found as well is that in terms of the results, that arts and health outcomes split into 7 categories. So they were mental health, social health, physical health, economic, art-specific, identity and knowledge outcomes. The mental health, the physical health and the social health were classed as health determinants. The economic, art-specific, identity and knowledge outcomes were health determinant outcomes, so they're the things that influence health. But what was really exciting was that in terms of mental health, so these are the things that most people said were mentioned 7 times more frequently than any other outcome. So if you need to focus on something, what this is telling me is that you should focus on mental health. Now what you've got here, so this list here, that's the Art of Being Healthy framework. And it's got the 7 outcome themes and all of the sub-themes as well that relate to those categories, the positives and the negatives. And the reason why this is important is because this is now a list for you of the health value of the arts. So you've got a list of things that you can look through and see if that's what your program is helping your participants with. So, in terms of mental health, now if we focus in on the mental health, there were 20 sub-themes. The one that people mentioned most frequently was happiness. When I asked people, why do you engage in the arts? The first response I got back was, because it makes me happy. Positive mental well-being. They also enjoyed it. It led to, them being more resilient, the creation of good memories. For some people, it reduced their stress. For others, it was relaxing. For others, it energised them. So there was a variety of positive mental health, positive mental well-being. On the negative side, though, and something that I want to bring your attention to was that they felt marginalised for being arty. There was an arty stigma. And this is advocacy-wise something that we need to change. It can't be bad to engage in the arts. We've got to change this view. And I think as well, if we've got a health message for the arts, that will help to change it as well. Because arts is arts, and it's great, and we should be doing it because it's arts, but also arts is good for your health. So I've got an activity for you. So what I want you to do is, on this side of the page, these are the list of the health outcomes, the positive health outcomes that people get when they engage in the arts. Now, if you run projects or workshops, programs, I want you to look through the list and I want you to tick or underline the things that you think your participants get when they engage in the arts. Okay? If you don't run programs, then I want you to look through the list and I want you to think about what you get from the arts. So I'll just give you a couple of minutes to do that. Was that clear? Do you want me to go through those instructions again? No? Clear? Okay. One more time? Okay, so you've got your list of mental health outcomes. If you run programs, I want you to go through the list and think about what your participants get when they engage in your arts activity or program. Now, if you don't run a program, I want you to look through the list and think about what you get from the arts when you engage in the arts, what mental health outcomes. And if you finish before everyone else, feel free to flip over and go to the the Art of Being Healthy framework, and have a look at social health, physical health, identity, economic knowledge, and see if there are other outcomes that you or your participants get. So I'll just give you a couple of minutes. So mental health side first. That's that side. And then if you're ahead of the game, then the full framework. Okay, I think most people are finished. So how many people ticked happiness, enjoyment, confidence or self-esteem? Okay, that's almost everyone. How many people, when you do your evaluation or your advocacy work, talk about happiness, enjoyment, confidence or self-esteem? Not as many. See, we should be talking about these things. This is what, especially the media, they absolutely want to know about. Okay, so why is this important? Because it formalises the impact of the arts. It formalises the value of the arts. And it's, we're having to convince people here. We want funding. We have to convince people. And this is one way of doing it. It increases the understanding. It increases the support for the arts. And it's really important to know as well and to keep in mind that the focus here, if it's mental health, 1 in 5 Australians this year will experience mental illness. Can the arts help? When we're talking about the general population, if we're getting them involved, can the arts help? I'm going to say yes, definitely. Okay, in terms of evaluation, so the Art of Being Healthy framework has been used with Musica Viva and Rio Tinto in the Live Performance Plus program, Princess Margaret Hospital in the Artist in Residence program, St John of God in the Creative Arts pilot program, also the Biography of Toys program, and the UWA Winter Arts program. And what we do here is, so we pretty much sit down with the framework and we look at, okay, so in terms of the program, what sort of health outcomes does a program give? So in terms of Musica Viva, we were looking at mental health, social health, art-specific and knowledge outcomes. So once we'd identified them, we could create then an evaluation survey that focused on those things. So you can see there that we've got knowledge questions, social health, art-specific, demographic. But on there, I'm not sure if you can see it very well, you can definitely see it on your handout, is the smiley face scale. So before they go to the concert, they fill out the smiley face scale. And then as soon as they finish the concert, they fill out their smiley face scale. And we've been able to show significant, so statistically significant change in affect, so happiness, pre-post that event, which funders love. They love to see significant change. And we've been able to show that. So all of the evaluations that I've used that with, we've been able to show that change. Something that I will say though is, one, with these sorts of scales, normally you would use a 5-point Likert scale. For the arts, that doesn't seem to be enough. You need the extra few faces because most people will usually start at a 3, 4 or 5. So you need to give them actual more room in terms of how they feel. Also, it's really good to think about a baseline because the fact is that if you're about to go to a concert, you're already feeling pretty good. So you need to give them an opportunity, maybe at registration, to just tell you how they feel there as well. And then you've got actually great results because you've got this baseline then before they go to the concert and then after the concert. So you can see this amazing jump. Advocacy. People absolutely want to know about this. So this paper is currently in the top 1% of articles by attention internationally. It has over 900,000 Twitter followers. 47 newspaper articles, so newspaper, radio, magazine, e-articles, and also letters of correspondence from both the WA Arts and the WA Health Minister. I also sent it to other people as well, but they were the only ones that responded back. But I assume the other people read it. Okay, so the story so far. So we've got a definition of art so we can write our survey. We've got the health outcomes, and we've found that mental health is the thing that people mention most frequently. So there's a reason now why we're quantifying arts and mental health. So how many hours of arts engagement is associated with good mental wellbeing? So now this study as well, if you're looking for funding and you need to quote a study, this study is available for free. It's in BMC Public Health, which is also a health journal. So the aim was to quantify the relationship between arts engagement and mental wellbeing. And why? Well, very little was known about this dose-response relationship. We know about it relating to sport, but we don't know about it relating to the arts. And also when it comes to the general population, a lot of our work is about specific programs. Very little is done at a population level. But health people, they want to know what's happening at the population level. That's usually where their health dollars are usually spent. So who's this of value to? Well, it's of value to artists, arts organisations, the health professionals, the clinicians, the health organisations, government, researchers, and most importantly, the community. Why? Because this could be improving people's mental wellbeing. Evaluation and advocacy, it gives us a focal point. Also health messages, guiding policy, guiding practice. But then also in terms of people, in terms of their everyday living, this could help to maintain and improve their own mental health. So by people engaging in the arts every day, taking time out to engage in the arts, it could improve their mental health. Which at the moment, I don't think that we have that sort of, at the moment it's about, they almost need permission to engage in the arts, and maybe this is the permission they're looking for. So then we change arts from being something, they can do if they feel like it, to something they should be doing, just like the Fine 30 message. Okay, so we did a telephone survey. We used a CADDY system with trained interviewers, a random sample of the general population. 702 people participated in this study, and we had a response rate of 71%, which is actually quite high for a telephone survey. Now, the survey was split into 3 parts. So we had the arts questions from study 1. So here what we asked about was the method and the art form that they were engaging in. So we were asking things like attendance. So in the last 12 months, have you visited or attended any performing arts events like? That was the level that we had to get to. If they said yes to that, we asked them to describe the activity. And then once they'd described it and we were sure that they were engaging in the arts, we asked how many days they'd engaged in and then how many hours. So from that, we could actually have hours per year engaged in the arts. In terms of mental wellbeing, we got permission from the University of Warwick to use the Warwick Edinburgh Mental Wellbeing Scale. And what this is a scale specifically for the general population, where you can actually ask questions like, I've been feeling so here optimistic, useful, and you get a scale from 1 to 5 where they can rate it. And the scale then ranges from 14 to 70 with an average of about 51. We also had confounding variables. So what confounding variables are is, if I say there's a relationship between arts and mental wellbeing, you'll always get someone who says, oh, well, come on, only rich people engage in the arts, and rich people, of course, they're happier. Or people who engage in the arts also engage in sport. Maybe that's why they're happier. Well, we took all of that into account, so it's not that. So we took into account demographics, so sex, age group, location, income, education, marital status, and whether or not they had children. We took into account their general health. We took into account their sports engagement, their religious activities, and whether or not they had had a holiday for 2 or more weeks in the last 12 months. So all those things that are related to arts and to mental health that people could say, it's probably that, it probably isn't the arts, we took into account. So first of all, we found that 83% of our responders, when we phrased it in a different way and we actually led them through the different arts activity, 83% of people had engaged in the arts. We were happy with this because this actually fits with what the Australian Bureau of Statistics says, so great. We also then adjusted for all of those confounders that I was talking about, and the answer you've been waiting for. We found that people with 100 or more hours per year or 2 or more hours per week of arts engagement had significantly better mental wellbeing than those with none or lower levels of engagement. So, how many hours of arts engagement is associated with good mental wellbeing? 2 or more hours per week. So the person who said 3, you were almost right. So why is this important? It's evidence of an arts-mental health relationship. It's the starting point in terms of a dose-response relationship. So this is an association, so we need to now move to causality. It also says to the health people, could the arts be a suitable strategy for health promotion? Because remember, 1 in 5 Australians will experience mental illness this year. Could the arts be helping? Why haven't we got this as a strategy when it comes to health promotion? We obviously should, but we need some more research. Okay, in terms of evaluation and research, so this is a starting point. This paper only came out in January, so it's only 5 months old. It's fairly new. But it does offer guidance when it comes to programs, evaluation and research, so that 2 hours per week. In terms of dose, this was used for Voluntary Arts Week in the UK in terms of giving people an idea about how much art they should be doing. And it's also being used by Christchurch Canterbury University in the UK in their Design for the Up for Arts program for isolated older adults, so they'll be engaging in 2 or more hours per week. Advocacy. In just 5 months, this paper is already in the top 1% of articles by attention. And when it comes to altmetric, they track everything from, Nature through to all the fancy journals. This is about 5 million articles that they're comparing it to. It has 720,000 Twitter followers in 5 months, most of which are the general population. The general population want to hear about arts and mental wellbeing. They want to hear about arts and health. In terms of the radio, it's been syndicated to 62 radio stations around the country, 26 Facebook posts, 19 newspaper, magazine and e-articles. People want to know about this. But something that I will say is my most useful tool when it comes to advocacy is Twitter. So when you've got something to say, tweet it, retweet it. And then there's something that's called Twitter gaming. You'll see it on your list of advocacy things that I gave you. I like to think of Twitter gaming as collaboration. So what that means is, are you on Twitter? Say yes. Okay, good. We follow each other on Twitter. I'm about to say something about arts and mental wellbeing, and I direct message you ahead of time and I say, in an hour, I'm going to actually send off this tweet about arts and mental health. Can you retweet it for me? I have 3,000 followers. You've got 2,000 followers. You retweet it, I've tweeted it, you've retweeted it, it's now gone to 5,000 people. If they retweet it, you can kind of see that flow-on effect. So in terms of the arts, collaborating, really important. Okay, where to from here? So we need more research. So this is an association, we haven't got to causality yet. We need to do more research so that we can get to that. We also need to make sure this can be replicated. So if anyone wants to repeat this study, more than happy for you to do that. We also need to start thinking about the value of the arts differently. So we need to start talking about arts. We need to talk about more than arts and participation or arts and economic value. We need to start talking about arts and health, arts and mental health. And once we actually start talking about arts in a different way, we need to make sure that we're actually reporting this. We need to make sure that we're telling people about it. So advocacy and evaluation. So what can you do? So first of all, what you can do is think about the value of the arts and consider health when you're doing whatever work you're doing. So your programs, your workshops. Make sure that you evaluate. And when you evaluate, have a look through the list, you've got it now, and think about whether or not there's a health outcome that you can maybe put in there. In terms of advocacy, use the 2 hours per week. You've now got a stat that, you know, people will, I guess, respond to, but also it's numbers. When it comes to funding organisation, government, they want numbers. You've now got a number. And in terms of advocacy, so once you've evaluated your program, make sure that you're telling people how great your program is, but also your fantastic evaluation results. That's part of your advocacy. And send it out to, you know, like I said, the funders. Make sure your funder definitely knows about it. But your funders, government, and so on, make sure you're sending it out. Okay, so that is the list of the papers that I've talked about today. The Art of Being Healthy is in BMJ Open, it's free to access. The Art of Being Mentally Healthy is in BMC Public Health, also free to access. Both of those health journals. That's a list of all of my co-authors, and I'd also like to acknowledge that the funding for these projects were from the Department of Health WA for our Future Health Fellowship, and also Healthway in terms of a Research Starter Grant and a Research Training Scholarship. Okay, thank you. Thank you for that. So that's my email address and my Twitter handle. So please feel free to follow me. I will follow you back. And if you have any problems with getting the papers at all, let me know. I'm more than happy to send them to you.
Questions?
Yeah.
Do you want to ask?
Questions? Yeah, look, I'm going to say no to that. But, you know, keep that in mind. So how many hours of arts engagement do you need for good mental well-being? At the moment, the association says 2 hours per week.
I've got two questions. Firstly, is there a measurement of how much arts engagement Australians currently get?
I think there is when it comes to the ABS. I think it's around, I think it was 86 in terms of their engagement, 86%. Or maybe that was visiting a venue, but I'm sure that there actually is in terms of the ABS. But I'm not sure whether their cultural section is still here or not.
I'd just be interested if, you know, there's a measurement saying Australians currently get 1 hour a week, they should be getting 2.
I don't think that there's that measure. I think there's just an overall measure that actually says... So the question was, is there a measure that says they're getting 1 hour per week? I'm not sure about that. I know that there's definitely one that says, you know, overall this many % engage in the arts.
And the second question was about any resource around how to phrase questions. I mean, the smiley face response mechanism looked really interesting.
Yeah.
And that seems to be sort of the next step after having a look at all of the outcomes that you're hoping for.
Yeah.
Is there a resource you can recommend that guides us in actually phrasing the questions?
With that one, I'm going to say in the same way that, say, when you're running an arts program, you get an artist to run the arts program. So, you know, say as an academic, if I was running an arts program, I'd get an artist to do that, because although I might be a painter, you know, that's not my skill. I would say that when it comes to a survey, it's not fair to expect the artist to also become an evaluator. So I think because you need someone who can analyse your data for you, you need someone who can actually find whether or not it's statistically significant or not for you. And even, you know, the phrasing of the questions, what's better, you know, should this be an open-ended or a closed-ended? Should it be a Likert scale? Those sorts of questions. Is this, you know, an agreement scale or not? I think it's good to get someone on board, even if all they do is give you some advice. But having said all of that, if, you know, you can't afford it, because let's face it, you need the money for it, even if all you're doing is adding to the end of your question, you know, to your participants, did you enjoy it? Did it make you feel better? Even if that is just a yes or no, at least you've got some data. Yeah.
Thanks, Christine. There's just one small observation which I've want to share with people and you is that it's better to actually use the term arts and crafts because arts is seen by a lot of people as too remote, but crafts is actually part of mainstream life and people understand it, and it's actually a very powerful tool in the same way that you're talking about just arts. So it's something which I've noticed in regional areas is that crafts is far more powerful than just the term arts.
And the experts agree with you because they actually talked about it as visual arts, design and craft. Craft was important, so yes.
I'm Naomi Edwards from Patch
Hello.
Theatre Company. Just wondering if there's an equivalent, I'm hoping for an equivalent study for children, or because this study was for over 18.
I don't think there is. When it comes to the general population and quantifying, we're at the starting point.
Anyone else? Yeah.
Just a question with regards to the confounding variables. Prior to that, were there any indications for particular cohorts in terms of intervention and encouraging art in those cohorts?
So there are, say, in prisoners, older adults, teenagers, so disconnected youth. So there are a lot of, in terms of groups, but not at the population level. But I think, like I said at the start, my end game here is a health message for the arts. And so what I'm doing here is taking my population health knowledge and actually applying that to, I guess, what needs to be achieved for the arts to be taken seriously in that sort of game. Yeah.
Thanks, Christina. That was a great talk.
Thank you.
I just wondered, in terms of the research, for example, the Australia Council undertakes, did you talk to their research department, and are they currently undertaking any similar research in terms of arts and health?
I haven't, but I probably should, so I'll note that down.
Thanks.
I think there was a question up. No?
No. Anyone else?
Mandy Brown, Country Arts SA, thanks. Thank you for your presentation. I'm just wondering, with anecdotal, like I work in the Aboriginal program in Country Arts SA, so I deal with Aboriginal communities around the state and artists, and I'm wondering how to capture anecdotal quotes, positive and negative, to put forward for funding bodies and things like that.
Sure. Usually when I do my evaluations, I collect that information as well. So people will say something to you, so you note it down. And what I like to do is I like to match it up. So, I was saying that, you might ask people, did you enjoy it? And did it make you feel good? And so you've got that. So then you might have the, 90% of people said they enjoyed it and 100% said that it made them feel better. And then you've got the quote in terms of, so, say while you're sitting with them, you might ask questions, but you do need to get permission to use that then in your evaluation. So you need to make sure that you've got consent to use that. But that could be one way to say while you're making their comments that they're making. It doesn't need to be a formal interview. It can be while you're sitting and making with them, asking them the questions, but, letting them know that, I've got to write this report, so do you mind if I ask you a few things and while we're working on this together?
See, most of them come up in conversation.
Exactly.
Or just a byproduct of just general chat. So that's where it's sort of like, I don't want to be seen to be writing stuff down or having to ask their permission there and there. Can I use this? It's just afterthought, and then how do I do this? How do I capture that?
Is it possible to, say if you're in a group, even if it's a hands up type of thing, to maybe ask, how did you enjoy that? And for them to tell you, and then, did it make them feel better? And then that way, even if it's not, say, a piece of paper that you're giving them, whether you can collect that information that way. Because from what I found, so before doing my arts and health work, I used to evaluate for government organisations. So I'd be the person, they'd give people money, and then I'd be the horrible evaluator going in to see whether or not they spent it properly. They do like the numbers. So, having something where you've got a 90% of people felt better or 90% of people enjoyed this, and then you've got your quotes that follow, that's much more powerful than just the quotes.
Thank you very much. That was great.
Now, my email address is there. I can't stay because I have to go catch a plane, so I'm pretty much going to run out that door and go and get a taxi and go to the airport. So please email me or, like I said, tweet me. I will tweet you back. Yeah, I'm interested to know about your work as well. Thank you.
Thank you. It was fantastic.